And it's just tremendous information, but also the importance of safety and governance when it comes to client safety and of course clinician first when it comes to development and information. And since then, as a clinician, as an healthcare AI executive, I have tested probably 10 different EHR or systems that essentially is marketed stating that they're safe for clients, both the clinician and the client base. And after testing them, I go, as a clinician, I can't even use this system. Why would I want my clients to use this system? Right? There's nothing out here in our world, both medical, behavioral health, whatever you call it, to actually keep governance or had the guardrails essentially to keeping client-centered information safe as well as the clinician in the loop. There is no trauma-informed framework systems that grounds the client to in the beginning of the intake form, to the middle of the intake form, to the end of the intake form that help them ground and feel more in control in that moment. For me, the uncomfortable part of this was the level of personal accountability. But as a founder, I had to make the decision behind the product itself. Win, right? How do you win in this? First of all, as a woman, it's, and there's statistics out there, right? Women in the healthcare, not just in healthcare, but in technology or in AI, is very, I wouldn't say non-existent, but it does exist. It's just really small. So coming in as a woman-led founder in a healthcare AI system is not really heard of, to be honest with you. I mean, it's out there, but it's really small. So what I've found out from my many years of research and talking to developers and my consulting team is that they go, Nadege, there's nothing like this out there. And I go, no kidding.
That's why I built it.
This is why I am here. Now, I'm going to challenge you and ask you, how do you plan on implementing a trauma-informed framework first with regulation and client sensitivity? And I get this blink stare in eyes and they go, we actually never done anything like that. I said, awesome, let's do it then. Yes. So I would not be human, first of all, if I didn't have self-doubts when it comes to developing these systems, right? Yes, it's not an easy venture seeking out therapy. But the point is, this with these system is that, is it clinician-led? Is it a therapist-led? Is it a doctor, a physician-led system? Meaning we come in, those providers come in with the ideas and the framework and the governance and the safety, and then go to the developers, the engineers and say, hey, your skill set is amazing, but can we tag team? We have to implement trauma-informed care. We have to make sure the client's consent forms are at every screen that the client is seeing. There's not a place where we can go and look up this information that says, this is what every organization in this earth or in the United States must follow when it comes to implementation, when it comes to scaling governance and make it a business. Name accountable humans. Now, mind you, I didn't say agents or AI agents or cloning agents at all. Way too late, because the most important aspect of the system I'm creating is keeping clients centered first, with clinicians' expertise first, no matter what. And I keep saying, I said, I hear your frustration. I hear where you're coming from, but can an AI system really do and provide a compassion work in the heart that you provide for your client? If I could speak to that woman or women's or just myself 10, 20 years ago, right? I would tell her or them that the gap that you see is real. You're not crazy. Jeremy, but the beautiful thing about fear, right? Fear is there to help us kind of get a foot in the door, not just kind of push us through. But fear can keep us stuck, going through the same system, using the same system, and we just keep at it, and it's not helpful. So what I could say to these women, or even to anyone, is you see the gap. Surround yourself with like-minded individuals who also see this gap, and you guys will make that change.